in contract with Life Healthcare, which looked after about 2,000 patients. Now, the Health Department saying it will not comment on the cause of death of those nearly 40 patients until investigations have been completed. A huge issue in Gauteng today. The MEC joins me now. Thank you for joining us, MEC.
Thank you, Francis, and thank you for having us.
Is it still your stance that you're not going to comment on the causes of these deaths?
Yes, we're not going to comment on the cause of that, but we are, in terms of the work that the department has done, we are almost complete with that work because we started last week. We've also consulted with the Minister of Health, and we've asked him to appoint the ombudsperson to look at our work independently, so that when the report is finalized, we know that someone independently from ourselves has looked at the report. So that's what we've done, and I think we're pleased that the Minister has come on board to support us through the ombudsperson, and we'll wait for his report to be finalized.
In the meantime, people's imagination is running wild. Were they not given medication? Was it more sinister than that? Were people smothered in their sleep? Can't you give us any indication of the trends, just to help the public to assess the situation?
No, Francis, we work in the health sector every day, and I'll be lying to you that there is no loss of life in our institutions. And I want to say on behalf of government, our condolences to each and one of those patients and the families, particularly those who do not have any loved one who ended up being buried by the state. Any loss of life is one too many, and that's why we've decided to do this work. And as far as I understand from the doctors I work with and from and senior officials who are well qualified in the subject we're talking about, and it's important to indicate that no one can simply die simply because they are moved. That is not possible under any circumstances. That's why getting to the details about the cause of death of this individual is not going to be appropriate, and I don't think it's ethical. And I think of importance, and I want to highlight that some of these patients and any other patients may have underlying causes. For instance, this morning I went to the doctor. If I were to drop dead now as I'm sitting here, the patient, before anybody certify me dead, or they want to know what was the cause of death of my life, they have to go through the file and go to Charlotte and check what is it that the medication I've been taking, who was prescribing the medication, for how long I was on that medication. So the history of the patient is very important. That is why we shouldn't take this matter lightly and make them a political football, but instead let's allow the work that we have done. Now we want to subject it to the ombudsperson, to the health ombudsperson, which has been appointed by the minister, to allow that work to unfold. Once that has unfolded, we should be in a position to talk to the principal. Even then, we would not be able to reveal any cause of death, because again, it will be crossing the bridge, the ethical line that the doctor and the patient have.
Well, what if the families don't mind you saying the cause of death?
No, because the families can do that on their own, but we as a department, ethically, we're bound not to reveal anything. For instance, if I were to drop dead now, my family has and between me and the doctor, my family can tell only the close one what was my cause of death, but the doctor is not entitled to go in public and reveal what was the cause of death of a patient. So we are bound by that and must continue to respect the rights of each and every one of the millions of patients that we're serving in the state hospital, because if we cross that line, we'll never be able to come back.
Okay, but I guess we want to know that you will let us know if negligence was at play. I do understand what you're saying. That
Francis, maybe let me say this. We were the one who revealed the information to the Legislature. No one held a gun to our heads to reveal this information. We revealed ourselves. We've also revealed that we are doing our own investigation. We've also decided that because people do not trust what we have done or what we are doing, we must subject this to an independent person who happened to be the ombudsperson, who's independent. He's doing his work wherever else the minister has found him. He's going to be able to say, yes, here you are wrong. Even the word is negligent, indeed he's going to be able to say so. And we're going to accept the finding of the ombudsperson and be able to work from there. And of course, the families are going to be shared with the report when it comes out, once it is finalized. I
understand what you're saying, that they didn't necessarily die just because they were moved, but nearly 40 patients, and these are psychiatric patients, so there was no physical illness, well, not that we know about, in all of them. So surely this points to negligence.
No, I don't think so, and I don't want to again to sit here and begin to make assumption. It will be appropriately very incorrect for me to do so. Let us wait for the report to be able to say what exactly the cause of death of is this individual. I may be having a flu, I may be struggling for whatever, but my cause of death may not be necessarily what I'm struggling for about now, maybe something else. So the pathologists who are well trained in universities understand these issues, together with the ombudsperson, are going to tell us what exactly is the cause. On the basis of that, we will then be able to embrace the report and its recommendation and take the process forward. But our responsibility is to what is right and find justice as much as possible.
So you're saying it's not necessarily higher than the average death rate. Surely we can look at how many people have died in these sort of NGOs.
We've looked at statistics in life. Remember, these people didn't die on one day, all of them. We started moving patients from the 1st of April 2016, and the last patients were moved, I think, the last week of, towards the end of last week, the 3rd week of June, and that's where the movement happened. It was not all of them, 1,400 of them at one day in one go, and they're moving different institutions. It was not like that. We moved them in different phases and in different batches, and that's why we were able to know who is where and who has a relative, who doesn't have a relative, and in going through the clinical files as the team is done and handing that to the ombudsperson is much more appropriate for us to be patient and be able to wait for the outcome and be able to deal with the outcome thereafter.
Even this is murky. Why was the contract with Life Healthcare terminated in the first place? 3
reasons. The first reason, Francis, is that the National Mental Health Legislation passed in 2002 indicate that mental health patients should not be treated in confined places where they do not have movement and all of that. Largely, that should be treated in communities, in environment where there are communities around and whatever. And also the role of their families is very central in the rehabilitation of this patient. Secondly, was compliance with the Public Finance Management Act. This contract has been running for more than 34 years, and the prices has been escalating over a period of time, and we're not able to end the contract on the basis of just without following any tender processes. We had to, if we wanted to end the contract, we had to go through the tender processes, but we've decided that we're not going to go through those processes, but instead we'll renovate facilities in our own facilities, as well as support the more than 118 NGOs who've been doing work in the mental health space. The third reason was the fact that the price of treating per patient was becoming too unsustainable. Those are the 3 major reasons, and I think we're happy that the resources that we've been able to save out of the contract, which is running close to more than 300 million rands, has been reinvested back in hiring more doctors and nurses in this different psychiatric institutions, as well as supporting NGOs to hire care workers and nurses, as well all the life and nurses who were employed then, and as far as I know, 98% of them have been hired to look after the same patients whom they're looking after whilst they're working for Life Esidimeni.
And a lot of people are asking, how did you allow this transfer? How did you allow them to be moved without their clinical files going to those NGOs? Surely that puts people in danger.
Remember, this process we didn't, I am not a medical doctor, I am not a nurse. We're working with a team, plethora of people who've got the necessary qualifications, as specialists in psychiatry and also for other disciplines. Some of the nurses have specialty in mental health as well as psychiatry. We also have mental health review board, which also the team is constituted by doctors, medical doctors, as well as psychiatrists. So the team that we work with, and as well as we had the doctors from a different specialized institution like Tara, Stekfontein, as well as Cullinan Rehab, who are part and parcel of our team. So we went through that, and they've gone through, they went to see the patient. Some of the doctors were hired by Life to do sessional work who were working for us. They also shared information of the patient. So we had sufficient information to move them. However, the clinical file is something that now we are getting, and we'll be in a position to trace what are the previous conditions of this patient, and the doctors were involved and the nurses in managing this whole thing.
I'm just trying to understand this. I'm not a doctor, but I would think that the history is crucial, and it means you don't have to start again with a patient, and that you know about about risk to that patient? Are you saying the doctors at the time said it was okay to move them to these NGOs without
Yes, as I'm saying, the doctors and the nurses, and together with the mental health review board, we took a collective decision to move the patients on the basis of that, of the information we had, because we couldn't wait for clinical files. If you were going to wait for clinical files, probably we could have waited for another 3 years. We move the patients and continuing to get the clinical files. Some of them we have now, and we should be in a position to move and whatever. But also, when each and every one of those patients move there, we ensured at least that they have one supply of medication. Once they were relocated in the different places where they are, whether Sterkfontein, with Stara or Kalinen or any of the NGOs, they were then reassessed by the team of doctors and nurses in the new places where they're being admitted, so that indeed we either continue that regime of medication they came with, or we simply give them different medication. All of that work was done. Those were not tested with HIV, of course, with their consent, the HIV test was done, and those who did not know any other elements, those have been done, and those were not on ARV treatment, some of them have now been put on those. So that has been a very important exercise to go through all of that.
Some of the names of these centres, Takalane mentioned, you say that you've visited some of these NGOs and they're fine, which is different to what SADC is saying, for instance.
Takalane has been in existence for more than 15 years.
And what did you see when you visited these NGOs?
It's not started yesterday. And they look after severely mentally ill patients. You've got very dedicated nurses who work in that institution, who work extremely hard. And I think it will be unfair for SADC to come here and continue to lie to the public about some of these NGOs, because they're doing incredible work in looking after extremely difficult situation of caring for those patients. Some of them who don't even have families. So I think it's inappropriate for SADC to continue to that. It's also incorrect for SADC to continue to want to coach families to what to say in the department, because we've confronted with them with that information. We've also confronted different families to say, are you aware that what SADC is saying or doing to you, you are being coached, what is being done? They said they're establishing a WhatsApp group to say, this is what you must say to the Department of Health. That is absolutely incorrect.
This is a serious claim. So SADC is telling the
families and we've got even evidence of that, and we've shared with them. This is what we are doing. And then I think it's important for us. We are continuing to want to work with SADC, because they're an important institution. We have even engaged with all other stakeholders that are very important in this equation. So therefore, let us not play politics or games with patients' issues. We should never do so.
MEC, we've run out of time, but there are families complaining. They were complaining even at the time of the move. If it turns out that these people were put in danger because of the move, will you resign in that case?
I'm not sure families, the patients being put in danger. There's no family who fell in the process. There isn't a family who fell or a patient who was adversely affected because of the move. Let us wait.
We have claims from Charlotte.
Let us wait. Let us wait for the investigation to be completed. And one that has been completed by the ombudsperson, let's deal with the facts when we get to that.
All right. The timeline, when do we expect this?
We'll hear from the ombudsperson how much does he need, because he's got the files to go through, what we have done, what those files are from the clinical files that we're getting. We don't know how big or thick those files are. We'll hear from him how much time he needs to go through this report.
All right, we appreciate your time this evening. Thank you.
It's a pleasure.
MEC for Health in Gauteng, Qedani Mahlangu.